then we don't wanna progress to a shrinker yet, because, these cost like $1. These cost anywhere from like $10 to $40. So you're either gonna have to replace them more frequently if they're getting really soiled, or you're gonna have to be doing a lot more laundry to keep them clean. So wait till drainage is under control before progressing to a shrinker. In terms of deciding, this is not the only type of shrinker available, but it's certainly the most common. So transtibial come in these set lengths of like 18 inches, 24 inches, 30 inches. So to determine what length you're gonna get, you measure from the tib tube to the distal end of the residual limb. And then they also come in different widths based on the circumference of the limb. So you'll measure circumference at the widest point of the residual limb. Now these dummy legs are already kind of tapered and shaped down. In a real world scenario, they're gonna have more distal bulbous shape. So immediately post-op, you're most commonly gonna be measuring like right at the incisional line. And if they're still using the wound dressing underneath whatever form of compression they're wearing, then you wanna take into account the bulk of that wound dressing as well as you're measuring. And then as I don, so we often start with just the one layer, like Dr. Marotta was saying, and start with sizing up in order to be more cautious. And you can make this like a two-person thing if the patient's feeling really nervous about it, by like picking up and over the tender part of the incision rather than just dragging straight over it. You can also, if they're super tender, there are these donning aids called donning rings, and it basically acts as like a bridge over the most sensitive part, in order to make the process less uncomfortable for them. Think of it like, y'all have seen sock aids, right?
Yeah.
Think of it like a sock aid, but for your shrinker. And so I'm generally looking for both layers. Let me back up. So if this was their first time getting it on, we'd stop right there with the one layer. We'd reassess the later in the day or the next day, see how they're tolerating it, making sure that the nothing new is popping up with the incision. If after 1 to 3 days of however long it takes them to acclimate to wearing the one layer and we feel good about how the incision's looking, we can progress to adding in the second layer. So I'm looking for both layers to extend above the level of the knee, with the second layer just being a little shorter than the first. So like with how high I pulled it up initially, if I'm eyeballing it here, I might be above the knee, but like barely. And when I pulled this out of the box, like I did not measure this dummy leg to make sure that this is the correct shrinker size for this dummy leg, but I think it'll work. I'm gonna slide this ring up to the bottom end just so that we don't have any like major gapping of the fabric. And then I'm gonna turn it inside out on itself. And I'm not trying to Hulk up and pull it up as tight as I possibly can, just trying to get the wrinkles out, make sure it's smooth. Okay, so any questions on transtibial shrinker?
Did you already say when you're measuring for length, what's the upper limit that you use?
For transtibial, tib tube to distal end. Okay, so